Hello, everybody. Hi. Welcome to my YouTube channel. My name is Matilda. I'm your pharmacist, and my message is medication safety. I am concerned with you taking your medicines with safety and remaining safe while you're on it. And so, my last video, I talked about slow release tablets, and in today's video, I'm going to be talking about immediate release tablets. What is immediate release tablet? How should you use it? Safety tips that are concerned with your medicines. And so if you're here and you've not subscribed to my YouTube channel, what are you waiting for? Please subscribe for more medication safety tips. Let's jump right into it. All right, so what are immediate release tablets? Immediate release tablets are tablets that are formulated, like they are produced to release immediately, just like the name. So immediately you take it, in 30 minutes to 1 hour, the medicine is going to release the active ingredient to the site of action, especially where you're feeling discomfort, you're feeling pain, and then you have fast relief. So basically, if you want fast relief from disease conditions, immediate release tablets are your go-to. If you want to take tablets, not injections, not drips, immediate release tablets are tablets you should go for. So these are regular medicines, not like the slow release medicines that take their time, release over time. This one releases very, very fast. So what are the things you should take note of when you're taking immediate release tablets? Because immediate release tablets are released very fast into the body system for it to do its work. Like, if you're having a headache, to relieve you of the headache. If your blood pressure is very high and you need it to crash like very fast, it gets to work, does what it's supposed to do. So you will be required to take these medicines frequently. Remember that when I was talking about the slow release tablets, most times you may take slow release tablets for maybe once or twice in a day, based off of the fact that it stays longer in the body, it's not excreted immediately, and all of that. But for immediate release, right, you'll be required to take for like 4 times. You'll be required to take at least 3 times, because the active ingredients, the medicine that is meant to work in the body, has already been released and has done its work. So once the work has been done, it is excreted. So if you've been asked to take that medicine, say 4 times a day, don't decide on your own that, I'm going to take it twice a day, I don't have the time, because that medicine is not going to work the way it's supposed to. While you are there, maybe waiting to take twice a day, and you're supposed to take 4 times a day, you'd realize that probably the symptoms will be back. Not just probably, the symptoms are going to be back. So like I said, don't wait until the next symptom, or don't wait until you start to experience the symptoms of the disease condition before you take the next dose. If you've been asked to take 4 times a day, it means it is an immediate release tablet. So it means you're going to be taking every 6 hours. Once you take the tablet now, the next 6 hours you're supposed to take the next one. Why? Because the medicine has been released very fast and it has been excreted, and so you would need a refill so that you have the right amount of the medicine in your system, enough to deal with the disease condition. But if you wait until the symptoms come back, or you take 2 times instead of taking 4 times, the way the medicine has been designed to work, you're not going to allow it to work because you're taking it the wrong way. So after all of that is said, let's talk about the safety tips. If you're taking immediate release tablets, number one thing you should observe as a tip is make sure you take with a lot of water. Note that I did not say any kind of liquid, I said a lot of water, not alcohol. A lot of water, H2O, that's water. When you're taking the tablets, like, swallow with a lot of water, so that it would help with dissolving the tablet and help it to release as it has been designed to. Number two, ensure that you take as it has been prescribed. Ensure that you follow the timing of the medicines. I already talked about that. If you've been asked to take 4 times a day, please follow up and take 4 times a day. If you've been asked to take 3 times a day, follow up and take 3 times a day. This is so that your medicines will work the way it has been designed to work. If you do not take it as you have been, if you don't follow the timing of the medication, it will not give you the results that you're looking for. And then the third one is, do not double dose. For example, you were supposed to take that medicine, 4 times a day, and probably you forgot in the next 6 hours, and then you're remembering, say, when it is time for the third dose. Don't take the second and the third dose together. No, that is very, very wrong. It is not safe for you. You're meant to take one tablet at every 6 hours. So, what you do is, once you remember, take the next dose, which is one tablet. Don't double the dose, it is not safe for you. Just continue taking when you remember, take another tablet when you remember, and then wait for another 6 hours and take the next tablet. So if you're forgetful of the timing of your medicines, one thing that can help you is, you can set an alarm on your phone. You can put reminders on your wall so that you do not forget the next timing of your medication. So the last one is, there are some medicines that have been designed to work with food, while some medicines have been designed to not work with food. So if you're taking, for example, ibuprofen, right, the normal tablets of ibuprofen, you're supposed to take it with food so that it does not cause you stomach upset. And then if you're taking paracetamol, you can take it on an empty stomach. You can decide to eat food with it. It doesn't affect it. So ensure that you know the restrictions, especially the food restrictions that come with that medicine that you are taking. Those are the safety tips. So if you have taken an immediate release tablet before, what are your experiences? I would like to hear from you in the comments. Thank you so much for engaging with my video. If you found this video helpful, do like, share, and don't forget to subscribe to our YouTube channel for more medication safety tips. Until I come your way again, my name is Matilda. See you in my next video. Bye.